My name is Tracy. I'm a nursing student at Indiana State University. My health education topic today is adult binge drinking, screening, and brief intervention. According to the National Survey on Drug Use and Health, in 2018, 26.6% of people aged 21 and older reported binge drinking in a period of 30 days. The CDC says that there are 37 million adults who binge drink, and 7% would fall into the category of heavy drinking. The Healthy People goal for 2030 is to reduce this percentage from 26.6 to 25.4. That's still a really high number. That's about a quarter of our population. Compare this to the number of people who are actually diagnosed with alcohol dependence. That's a much smaller number at 4%. Binge drinking can be defined by daily or weekly number of drinks, and there's a difference between the amount allotted for men and women. For men, binge drinking is defined as more than 4 drinks on any day. For women, that number is 1 less, more than 3 drinks on any given day. For men, binge drinking can also be defined as more than 14 drinks per week, and for women, the amount is half of that. More than 7 drinks per week is defined as binge drinking. This infographic that's found on the CDC website also shows the daily amount of alcohol that would be considered binge drinking. But if you look in the middle of the slide, it points out kind of a startling statistic. It basically says that most adults who binge drink are not advised to reduce their drinking by a healthcare provider. Healthcare providers can make a huge difference in binge drinking. They can screen every adult for this problem, provide some feedback, and work with the person to decide that maybe they do want to drink a little bit less. Before we go any further, let's stop and talk about how much is considered 1 drink. It depends what you're drinking. If you're drinking wine, about 5 ounces is considered 1 serving. Beer that's around 5% alcohol, you can drink about 12 ounces to be considered 1 serving. 1 serving of a malt liquor that's around 7% alcohol, 8 ounces is considered a serving. And if you're drinking liquor, about 1 to 1.5 ounces is considered 1 serving. So why do we care about binge drinking? If it just happens occasionally, what's the harm? Unfortunately, there are a lot of risks to binge drinking. Some of those risks include having accidents, motor vehicle accidents, intimate partner violence, and there are some health considerations. Binge drinking can lead to high blood pressure, digestive problems, liver disease, some cancers, including breast, upper GI, and colon cancer. It can increase your chance of having a stroke, and it can lead to sexually transmitted diseases. So what is SBI? It's a screening and a brief intervention. This can be done on paper, it can be sent out electronically, or it can be done in person. It can be done in any kind of setting: primary health care office, a school office, a community health clinic. All of these are great places to do this screening and brief intervention. The screening portion of your SBI can be very simple, just 1 or a handful of short questions. I am actually a really big fan of having alcohol screening start with just 1 question. This 1 question gets you all the information you need to start a discussion about alcohol. That question sounds like this: how many times in the past year have you had X or more drinks in a day? X would be 4 for a female participant, and X would be 5 for a male participant. Here's another example of a quick screening. In this case, they've decided to still keep it simple, but they wanted a little bit more, so they chose to have 3 questions instead of just 1. When we talk about drinking too much or alcohol problems, there's kind of an assumption that we're talking about alcoholism or what a medical person would call alcohol dependence, not binge drinking. The screening instruments that are used in the alcohol SBI will identify both patients who are dependent on alcohol and those who are drinking too much but not necessarily dependent. The main target population for the brief intervention is people who are risky drinkers, about 26.6% of the population. The goal of their brief intervention is to motivate them to cut back or stop drinking. People who drink too much and are dependent also need help, but there's not as many of them. If you remember earlier, we stated it was about 4% of the population. For this group, the goal is different. We would like for them to decrease or stop their drinking, but a brief intervention by itself is not necessarily sufficient. The intervention can focus on motivating them to seek additional help. It's important to know all of the steps of a brief intervention. Here are some of the elements. A brief intervention usually lasts from about 5 to 15 minutes. Ideally, it's done the same day as the screening. To begin, you want to introduce yourself and ask permission to talk about the screening results. The person may say no, and that's okay. It's a good idea to start off by asking a very simple question. Ask the person what they like and what they don't like about their drinking. After that, listen to what they say. If they do identify things they don't like, you can ask them for more information about that. You don't want to argue with the person, but you want them to explore their own thinking and their own experience. At that time, you can ask them if they would like your advice. If they do, provide them with some reasons why drinking might be harmful to their health. Then you can listen for change talk. Ask them if they're interested in change. Summarize their interest in their own words. If the patient is interested in making a change, provide them options that they can choose from. Help them establish a goal and develop an action plan. Ask them if they'll agree to a follow-up visit. About 4 to 6 weeks is appropriate. Lastly, make sure you thank them for their willingness to discuss the topic. Even if the person is not interested in change, it's worthwhile that they agreed to talk to you about the subject. After talking to the person, if you decide that alcohol dependence is suspected, then a referral would be appropriate. Lastly, you want to take some time to document the intervention in the EMR that you use. Here are 4 references I used to put this presentation together. The first one is a step-by-step guide for putting together an alcohol SBI. The second one is the Healthy People 2030 Goals on health.gov. The third reference is the National Survey on Drug Use and Health. And lastly, the cdc.gov website that has a lot of additional information on drinking.